Thank you. Yes, thank you for introducing yourselves in the chat. Hello, everybody, and welcome to this is actually our first webinar for the Canadian Association for Global Health, and I just want to thank you all for joining. I'd like to just actually begin our webinar today just by acknowledging that I'm joining you today from the unceded territories of the Silks Okanagan First Nations here in Western Canada. And I also want to extend a broader acknowledgement to the many Indigenous lands and communities across Canada and worldwide, as we're seeing here in the chat, that continue to shape and sustain the work that we are doing to advance global health equity. And yes, please do feel free to introduce yourselves in the chat and acknowledge the lands that you're coming from. It's very special to see how people are coming from so many different parts of the world. So very, very exciting to see you all here. So my name is Dr. Shaheen Qassam, and I'm a Canadian Association for Global Health board director. You may hear us say the acronym CAGH quite a lot, but it basically means the Canadian Association for Global Health. I'd like to warmly, warmly welcome all of you here and just thank you all so much just for taking time out of your day to join us. It's really, really wonderful just to see such a strong mix of colleagues and partners and students just joining in the conversation from around the world today. So today's webinar demonstrates Canada's global leadership by highlighting CAGH as this multilateral network that just unites and brings together diverse disciplines and people from around the world to advance health equity. So specifically today, we're going to be spotlighting some perspectives across sectors and just really open up awareness about what it means to be part of this CAGH community, whether as individuals or institutional affiliates or emerging leaders. So we're especially excited to bring together some speakers today and voices from the civil society sector and from the student communities, which is super exciting, as well as the chairperson of CAGH to reflect on the global health collaboration in Canada and beyond, as well as talk a little bit about our conference as well, which is really a flagship event here in Canada. I'd like to mention that we are going to be recording this session. And so with that, I think I'll pass it on over to my wonderful colleague, Nandita, who I've been working with for the last couple of years, and to just carry on the flow here. Thanks, Nandita.
Thank you so much, Shaheen. And I would just like to echo Shaheen's welcome to all of you. We're really delighted to be having this event and happy to see so many people online. We had over 600 people register from 94 different countries, really showing the interest and passion that we all have for global health. So thank you again for joining us. I'm just going to go over some quick logistics in the agenda before we start. First, as Shaheen mentioned, the session today will be recorded. So please take note of that. And we will be posting a recording on the CAGH website as well as our YouTube channel. So you'll be able to find the recording afterwards. You've already been introducing yourself in the chat, which is great. So please continue to do that. Do type any questions that you might have in the Q&A box. You can find that at the bottom of your screen. For our panelists, they'll try to answer in real time or in the chat. We'll see if we have time for questions at the end. And then finally, given Canada's commitment to being bilingual, we apologize. We don't have interpretation, but we do have transcription available in French. And you can select your language at the bottom of the screen. You can select captions and you can select the language you prefer. So thank you all for making time to being here. We're really delighted to have this session with you. Really quickly, I'm going to go through the agenda so you know what to expect in the next hour. we are gonna hear, I'm gonna do a quick introduction activity just to get us warmed up. And then we're going to hear from our board chair, Dr. Saad Eldin Hassan, to give us a little overview of CAGH. We're then going to hear from Elizabeth Huang, who's going to talk a little bit about MentorNet. And this is a really exciting mentoring program that CAGH has really been leading for the past several years. We're then going to have a short panel and hear, as Shaheen mentioned, from some really different perspectives from civil society, from students, from academia, on sort of what this network has meant to advance their work in global health. And then I'm going to turn it over to Dr. Muriel Mangswing from University of Montreal, who's one of the co-chairs for the Canadian Conference in Global Health, which is happening in October in Montreal. So with that, I'm going to now turn it over to a quick activity, if you will indulge me. We have so many people on the line, and we want to kind of get a sense of what your interests are as well. So if you can go to slido.com and type in this code, there is a poll that should be showing up for you. And we wanted to know, in one word, how would you describe Canada's role in global health today? And you can respond as many times as you like. Try to just pick one word. And I'll give you a few minutes to do that. And then we'll sort of show what responses we get. As Shaheen mentioned, I too am a relatively new board member, but what I really love about this network is the community that we've built. And given the changing global health infrastructure, the landscape, I think community is really, really important. And so it's really an honor to be part of this network and to have all of you with us here. Okay, so I'm now going to share so you get an idea of the responses. Oops. Okay. So the way the word cloud works is the word that's mentioned most is the biggest font. And so we see leader, funder, pioneer, inclusivity, essential. So it gives us all an idea of what we're all thinking in terms of Canada's role in global health today. Changing. Good. Super. Okay. If you'll indulge me, we did have one more poll, a couple more poll questions that we wanted to do. The next one is, and it should show up, is to just get a sense of where you are joining us from today. So I know we have a lot of Canadians that registered, but we also had a lot of people from around the world. And so wanted to just get a sense of where everyone is coming from. Right. Okay, so still a lot of Canadians representing, that's great. But really also exciting to hear so many people, see so many people from other places. And that's one thing that we really value about this network is that it really is meant for everybody. Yes, it's called CAGH, but we really are an open and inclusive community of passionate people working in global health. Super. Also great to see some of our Francophone colleagues with us. Thank you so much for joining. Okay. And then I'm going to stop it. And then the last question, again, just for us to get a sense of why you were interested in joining this session and why a network like CAGH might interest you. So give it some thought. You can select more than once. Okay, so lots of interest in mentorship, which is wonderful. Of course, networking, connecting with others. some funding opportunities. Let's see what we have down here. Okay, wonderful. No one's interested in finding the world's best maple syrup. Fewer, but great. Well, thank you all for indulging us in this little activity. It just helps to get a sense of who we have with us. We can't meet all of you in person or online in this session, so this just gives us a chance to get to know who's online and who's joining us today. So thank you very much for that. And I am now, oops, sorry. I'll now turn it over to Dr. Saad. Let me just stop sharing. Am I still sharing my screen? No, okay. Super. Well, thank you, everybody. I'm now going to turn it over to Dr. Saad, who is the board chair of CAGH. He's also a senior health advisor at the Canadian Red Cross with decades of experience working in humanitarian settings across the world. And we're just so delighted to have you with us here today, Saad, and really thank you for your leadership of CAGH. So Saad, I will turn it over to you for a brief overview of CAGH. You have the floor.
Thank you very much, Nandita, and thanks, Shaheen, and thanks all for joining. Good morning, good afternoon, good evening to you all. Joining from various parts of the world. It's really impressive to see you here, and thanks for helping us build this global health community. Just give me a second to get the presentation started. So you should be able to see it now.
Yes, we see it.
All right. So I'm glad to be here just on this session to give a broad overview of what the Canadian Association for Global Health, or CAGH, is. But before I start, I have to start with the land acknowledgement. I'd like to acknowledge that I'm calling from Ottawa, the unceded and unsurrendered Algonquin Anishinaabe territory, and the peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia. Their culture and presence have nurtured and continue to nurture this land, and this aligns with CAGH values, role, and mission. Now, maybe a bit of background would help. For those that don't know CAGH, CAGH is a member-based global health organization. It was established in 2021, but as a result of an amalgamation of two great organizations, the Canadian Society for International Health and the Canadian Coalition for Global Health Research, with more than 60 years of combined experience. And basically, one of our key roles is to convene people across the spectrum of global health and global health career path, from students to researchers to practitioners and policymakers across Canada and globally, which is something that Nandita and Shaheen have highlighted. And as has been mentioned, we're proud to be organizing and hosting the Canadian Conference in Global Health, as well as the MentorNet program. And this year is the 32nd iteration of the Canadian Conference on Global Health. A bit of our role and mission. Our role, basically, I mean, we have three roles, which are conveners, partners, and champions. So CAGH, as a convener, bridges the gap between research and practice. We organize the CCGH, and as partners, we foster collaboration across the globe, working closely with Canadian, international, and low and middle income partners, as well as society organizations and universities. And some of the other panelists will share some of their perspectives on what it means to engage with CAGH. As champions, CAGH advocates for evidence-based policies and positive change to address social determinants of health and structural barriers to healthcare. And our mission sort of mirrors that, is to connect, engage, and mobilize. That basically mirrors convening, partnering, and championing across Canada and internationally. So how this looks in practice there are many ways in which this is demonstrated, particularly through engaging with students and emerging professionals. Supporting the next generation of global health leaders is one of the areas we're most proud of, with approximately 40% of our membership defining themselves as students and emerging professionals. And as mentioned, Gabriel will talk a little bit about being part of that chapter. We support the MentorNet program, which Elizabeth Wong is going to talk to you about in a bit. And this year we have 35 pairs of mentor-mentees making up the cohort, and you'll hear more on that. It is a program that's been running for years. We're very proud to support it. In terms of student chapters, we do have student chapters in a number of universities in Canada, and there are more that have expressed interest and more that are being introduced to CAGH and engaging with them. However, in addition to engaging with students and emerging professionals and those who are earlier on in their careers in global health, or at least sort of exploring that, we're also engaging with established institutions. Before I go there, just wanted to highlight this photo. This is the photo of the group that organized the Student and Emerging Professionals Day in the last conference that was held last year in Halifax. It's just such a vibrant group that really helped make that day a success. Moving on to institutions, this is a growing national and international network where we promote collaboration, knowledge exchange, and academic and organizational engagement. And these are the affiliates we have right now, which is also growing. We are really proud to engage with these institutions and to move this forward and to build this community. Now, you've heard mention of the Canadian Conference on Global Health a few times from myself and Nandita and Shaheen. And this is actually the largest and longest running global health conference in Canada with diverse international participation. And Muriel Maxeng is going to talk to you more about that, one of our wonderful co-chairs for this year's conference. It's an absolutely amazing platform for dialogue and collaboration, as well as networking, where we bring together policymakers, researchers, practitioners, and once again, students and emerging professionals to engage and discuss and learn from different experiences, as well as contribute to them. A look at last year's conference, which was held in beautiful Halifax, Nova Scotia. There, as an example, we had close to 800 participants representing 64 countries, half of which are low and middle income countries. For that conference last year, there were 530 abstracts reviewed that ended up in more than 240 oral presentations and 150 poster presentations and a number of workshops and symposia. So it's an absolutely amazing event, and it's quite energizing. And if you've been to it, whether virtually or in person, you'll actually know what I'm talking about. And we would love to see you there this year. I have to say that half of the participants are attend in person, and about half of them online. Now, moving on to this year's conference. And in line with our role and mission and our DNA of convening, partnering, and championing, the theme is to collectively reclaim global health equity, restoring commitment to action in a fragmented and uncertain world. And once again, this conference is our flagship expression of our role to convene. This is such a key theme, and it's such an important theme at this time. You see what's happening around the world, all the changes that are happening at the political front in terms of funding for global health, funding for different activities, climate change and the impact of climate change on people and the emergencies that are happening, as well as the spread of diseases and spillovers of diseases from zoonotic spread to human spread. And you're aware of the headlines that are happening right now all over. And I think some of you are probably joining, some of you are joining from Europe and other parts of the world that are experiencing hotter than usual climates and are wondering what the impacts will be. So the theme is very pertinent, and there is a lot of uncertainty, a lot of fragmentation, and probably Muriel will talk to you more about that. But underneath that, to sort of unpack that, we have three sub-themes that address the upstream, the downstream, as well as the link between research and action. Because research without implementation is not very helpful, and implementation that's not informed by evidence is not as helpful. So we like to sort of pair those under sub-theme 3. And under sub-theme 2, we'd also like to give voice to the marginalized voices, whether it's you helping with drones to transport medications or vaccines, or you're a community health worker that moves from house to house to spread health promotion messages or test and treat for diseases, or even someone that's using AI to make healthcare more accessible. We'd like to hear from you, those different voices, and learn more about that. This year's event is happening in the beautiful Montreal, Quebec, in October 16th to 18th. And registration is open right now. We'd love to see you all there, whether in person or virtually. All these activities, from engaging students and emerging professionals, from institutional affiliations, and the conference, and these webinars, including the webinar that we're holding today, wouldn't have been possible without partnerships and engagement. And here's a list of some of the partners that have engaged with us and have supported us in our journey over the years. And as you can see, it's a cross-sector kind of partnerships where we partner with different entities, from government, from private sector to academia, that promotes collective action and knowledge sharing. I wanted to sort of zoom in more towards those the last three logos there. When you look at CARTA, the Consortium for Advanced Research Training in Africa, we have quite a long relationship with them that started with one of our predecessor organizations, which is the Canadian Coalition for Global Health Research. And they're such a great platform, and we're one of the non-Africa members there that coordinate on a regular basis with them. Moving on to the Pacific Northwest Health Equity Network. This actually is another entity that sort of has its roots from the times of the Canadian Coalition for Global Health Research. And it wasn't called the PHEN back in 2004 when the CCAGHR held its event at Halifax. But over the years, that has morphed, and the PHEN is now part of CAGH, and we're proud to be engaging with them and partnering with them. And then lastly, Women Global Health Canada are a strong partner, and we've sort of been the host or the incubator for that body, and we've engaged with them a number of webinars, including one that was conducted last year on stronger healthcare workforce in Canada and globally. In addition, during the conference, the WH Canada has their meet and greet on an annual basis, which has sort of become a tradition for the Canadian Conference on Global Health. One missing logo in this page is actually that of the working group on climate change and health, which we're very proud to host. And they're very active, as mentioned, with all the changes that are happening right now with climate change and the impacts on health and other aspects. And they've held a number of webinars, including one in December that was on applying behavioral science for climate adaptation and water scarcity. So these partners are absolutely critical to our work, and we're very thankful to their support over the years and their continued support. Now, in addition to those partners, our members and affiliates are a key force behind all these activities. And none of this would have been possible without them either. And one thing that I would like to say is that the Canadian Association for Global Health Board is a working board, and it relies a lot on membership and also relies a lot on volunteer work. And all the presenters today are voluntarily joining this network and are people who are passionate and dedicated to global health and promoting and furthering health equity. And that's what brings them here. And that's the beauty of having this community. What it means to be a member and affiliate, these are some of the things that represents some of them, but the panel will address some of those as well. Partnership, opportunities, mentorship, visibility, advancing global health equity. These are themes that resonate with our role, mandate, mission, and they're part of our DNA, and you'll see recurring time and time again. So in brief, what is CAGH? We consider ourselves a national convener and a catalyst for global health equity. And this takes us back to the three roles that were mentioned earlier of convening, partnering, and championing. We convene webinars like the one that we have today and the conference, the annual conference, Canadian Conference on Global Health. We also strengthen partnerships and knowledge exchange through the different networks that we have. In addition, we advocate for key global health issues and priorities. And you've probably, if you've been following our website and our social media outlets, you've probably seen some of the postings that relate to these different issues that advance dialogue, collaboration, collective action, and global health equity. So if this inspires you to join, we'd love to hear from you. Your voice matters. Please register today or reach out. We'd love to hear your voice and help us build this community for global health. Thank you very much.
Thank you. Thanks so much, Saad, for that brilliant overview and inspiring words. I think this really is about community of passionate people dedicated to global health equity, and it's really great to see all the work that's being done. I'm now going to turn it over to Elizabeth Wang, who's going to give us a little overview of MentorNet. Saad mentioned this mentoring program that has been a hallmark of CAGH for the past several years. And we'd love to hear from you, Elizabeth, about MentorNet and how that program operates and what that's meant to you. So Elizabeth, you have the floor. Welcome.
Thank you so much, Nandita. So good morning, good afternoon, good evening, everyone. I would like to begin by acknowledging that I'm joining you from the traditional territory of the Anishinaabe, the Haudenosaunee, and the Huron-Wendat nations, and the treaty lands and territories of the Mississaugas of the Credit First Nation. And I'm really grateful for the opportunity to live, work, and learn on this territory. I'm one of the co-directors of MentorNet along with Sebastian Van Gils, and I also get to work alongside incredible steering committee members, Joanna Rivera, Wes Navi, Jessa, and Elaine. And MentorNet is a mentorship program created by the Canadian Association for Global Health. MentorNet is designed to connect students and emerging professionals who are interested in global health with experienced professionals who are already working in the field. The goal of the program is not only to provide career guidance, but also to create meaningful mentorship relationships that encourage learning, professional growth, and discussion around critical global health issues. The program usually runs for about 8 to 10 months. And then during this time, MentorNet and mentee pairs meet typically virtually, but they can also meet in person in a public space. One of the key strengths of MentorNet is that it combines both mentorship with structured educational support. So CAGH provides participants with access to over 40 educational modules related to global health topics. And these modules include a variety of resources, such as links to academic articles, videos, and discussion prompts. Topics can range from health equity, Indigenous health, migration, mental health, reproductive rights, implementation science, and the long-term impacts of colonialism on healthcare systems. Each mentor and mentee pair is then also supported by a program liaison who is part of our steering committee, who helps guide the mentorship process and recommends learning materials based on the pair's interests. This gives participants both flexibility and structure throughout the program. What makes MentorNet especially interesting is that it recognizes global health as an interdisciplinary field. We encourage students and professionals from diverse disciplines, from business, public policy, international development, and beyond, those who just come from global health and public health backgrounds, because the reality is that global health challenges are complex and require collaboration across many disciplines. For mentees, the benefits of MentorNet can be significant. Participants have the opportunity to build relationships with experienced professionals, receive advice about career path, discuss academic and professional goals, gain an insight into real-world global health work. Many mentees also expand their professional network and feel more confident navigating opportunities in the field. Mentors also benefit as well. The program allows professionals to share their knowledge, support the next generation of global health leaders, engage with fresh ideas and perspectives from students and early career professionals. MentorNet emphasized that mentorship is not just a one-way stream, but it's a two-way learning experience where both individuals contribute to meaningful discussions and professional growth. In Slido earlier, I heard that Nandita mentioned that one of the reasons some of you joined today's session was that you were looking for mentorship. If that's the case, please be sure to visit our website to apply to MentorNet when the applications come out. Each year, the program receives significantly more applications to become a mentee than available mentorship spots. So please consider applying as a mentor as well. Thank you. Another important aspect of the program is that some mentorship pairs choose to collaborate on projects beyond their regular meetings. Past participants have worked together on conference posters, research papers, broadcasts, and educational resources. These projects can provide valuable hands-on experience and strengthen professional development. Overall, MentorNet is much more than a networking opportunity. It is a supportive learning community that encourages mentorship, collaboration, and leadership in global health. By connecting emerging professionals with experienced mentors, the program helps participants better understand global health challenges while also preparing them for future careers in the field. If you're looking to become part of MentorNet Beyond as a mentor or mentee, we're also pleased to let you know that we're currently looking for co-directors and committee members as well. Thank you. And I'll pass the mic back to Nandita. Thank you.
Wonderful. Thank you so much, Elizabeth, for that overview of MentorNet. It really is a dynamic program, and I think this idea of mentorship going both ways is really important. And so I would encourage everybody to consider joining, not just if you want a mentor, but also to be a mentor, because there really is a lot of learning that we get as mentors from our students and from others in the program. So thank you for that, Elizabeth.
Sorry, Nandita, it's Shaheen here.
Yes.
Just jumping in, Elizabeth, we just have a question here on from the audience wondering how people can apply for MentorNet.
Excellent question. So right now the applications are closed, but I'm gonna pop into the chat box our website for MentorNet, and feel free to visit it to check it. And if you're already on our mailing list, then that's great. When it becomes available, we'll be sure as using that channel of communication to further let people know. But please be sure to visit our website from time to time. And I just popped into the chat box. Thank you.
Thank you, Elizabeth. I'm sorry, one more question for you as well. How can people apply to become part of MentorNet program as a committee member?
Excellent question. So my wonderful colleague, Jessa, who's on this call, she's launching the application. You could send an email to us at and I'll pop the email address there as well. If you send us 250 words to briefly let us know why you're interested and why you'll make a great committee member, that'll be great. And then your resume, no more than 3 pages, and then we'll be happy to review it and get back to you in a timely manner. Thank you.
Super. Thank you so much again, Elizabeth, and thank you to everyone online for your questions. It's great to see so many people engaged. If you have more questions, please pop them into the Q&A box, and Elizabeth and others will try to answer there. I do want to move to our panel because we want to hear a little bit about what this network looks like in practice. So I'd like to invite Jean-Pierre Zili from Save the Children Canada, Gabrielle Chen from McGill University, and Margaret Mutumba from Western University and the Africa Institute to join me with their videos on, if you don't mind. And we're going to spend about the next 10, 15 minutes just kind of getting a sense from your perspective as different kinds of organizations and professionals, what this network has meant to advance your work. So what I'd like to do, maybe I will start with Gabrielle Chen from McGill University. And I'm going to ask you a question, but then when you answer, feel free to introduce yourself in more detail if you like. But I think what we'd like to know from you is how has being part of CAGH, and this network of professionals, other students, influence your day-to-day work, particularly at the university level, and how has that helped amplify the work that you all are doing in the McGill chapter?
Hi, everyone. It is such a pleasure to be here. Thank you for the introduction. And as it was said, I am a part of the student chapter at McGill University. So I've recently finished my undergraduate degree there. I'll be starting a master's at the same university. And I've been a part of CAGH for around 2 years now. I am both a part of the publicity side of it, but I also serve as a mentor within our mentorship program for CAGH, where I mentor two younger undergraduate girls. Being a part of this network has had a very big impact on my academic and my professional development. Uh, at the McGill chapter of CAGH, we really make it a goal of ours to provide students with a lot of different global health resources, both at the university but also across Canada. And it was through that resource list that I learned about an internship that was hosted by the School of Population and Global Health at McGill, and I applied for it. I received it, and ever since then, I've been working at the Climate Change and Mental Health Lab within the School of Population and Global Health. And the opportunity really would not have presented itself without the resource lists and the mentorship that was guided from other people in the club. And one of my own mentees this year received a similar internship at the same department. So it just really goes to show how much growth there is through this club as a young professional, as an academic. Um, and the experience working with everyone in the network of global health in this club at McGill has really helped me just broaden my view of what it means to work in global health, what route that can take, what you can study, what you can do, etc. Because there's so much diversity just in both the field, but specifically in all the people who I work with, and it's been a real pleasure. So.
That's great. Thank you so much for that perspective. And I think McGill has one of the biggest student chapters, and it's great to see that it's really helped facilitate some great opportunities for you. Thanks for that, Gabrielle. I'm going to move to Jean-Pierre, Senior Partnerships Advisor at Save the Children Canada. And for you, JP, I wanted to kind of get a sense, can you share one specific collaboration, connection, or experience through the network that has had an impact on the work that you're doing at Save the Children?
Yeah, thank you for the opportunity. And my internet's a little dicey, so I'll speak slowly and forgive me if it drops off. But the The CAGH has really been important for us as an organization as far as networking and making partnerships. And we've got some great mechanisms within Canada, like CanWatch, which is really good for mapping the Canadian landscape. But as far as reaching out to other in-country resources across the globe, CAGH has really been a strategic conduit in that way. So that's been incredibly useful. I also wanted to touch on the benefit of having CAGH as a channel for research dissemination. So this has been a wonderful opportunity for us to explore bi-directional learning, where we have our colleagues that work in many of the countries where we implement actually able to come to Canada and share what they've learned and being able to network and connect with various institutions on this side, rather than us going into these countries and doing the learning pieces just there. Um, it's also been really interesting for us to be able to get a better understanding of implementation that different partners are doing that goes beyond Global Affairs Canada programming. Within Canada, we tend to have our blinders on and we focus very much on our own funding sources. And it's really refreshing to see what other private institutional funders are focusing on. It's been really important to follow various trends in programming and in research. Just recently at the last conference in Halifax, I was really interested to see the type of research that's still happening around communicable diseases, around FGS, just to see if COVID-19 is still on the radar, and really interesting to see what other colleagues are doing. The poster presentation was incredibly useful, that hall that was hosted. I think another piece I wanted to note as well is that after I presented on a panel that Nandita had pulled together, I had a few recent graduates approach me and really ask me about the work that I did. And I always reflect on the fact that in the current job market, for many graduates, there's a lot more stability and perhaps more money in the private sector. And I think any time that we can leverage our experience to help new graduates get a foot in the door, it's really important, right? Because these are the leaders of tomorrow. And I was able to sit with a few recent graduates, talk to them about their career pathing. I was able to leverage some of my own contacts to help them get the foot in the door. And many of them actually ended up getting employment following that. So yeah, I wanted to say a big thank you to CAGH and hand it back to you, Nandita.
Sure. Thanks so much, JP, for those reflections. I think it's coming up again. This idea of bidirectional learning is really critical, and I think one thing that this network really fosters, which is really exciting, and great to hear that there is still an appetite for careers in global health. There are opportunities. So for new graduates, emerging professionals, the landscape is changing, but the work is still there. And so I think anytime we can find ways to connect is really great. Thank you for that. I now want to move to Dr. Margaret Mutumba from Western University and the Africa Institute. And as an institutional member, maybe you can give us some perspective on why a network like this, what kind of value this network brings to an institution like yours, and for other institutions that might be considering it in Canada.
Absolutely. Thank you so much, Nandita, for having me, and CAGH, and to all of you joining us from around the world. It's a pleasure to be here. As the director of the Africa Institute, I think the first thing I would like to flag when we're thinking about networks, and all of you who understand this saying can complete it in the chat, it takes a village to dot dot dot, and I'll let you finish that. And that phrasing is really what emphasizes the value. Absolutely, to raise a child, we have a great audience here, is what represents the value of CAGH. Global health in and of itself is global. It requires us to work with one another, to collaborate, to work, to leverage each other's strengths. And as an institute, as an Africa Institute that is based out of Canada, this is pivotal to the work that we are doing. And CAGH is a platform where you can connect to like-minded folks who are doing this important work. Global health feels like it's shrinking, and sometimes it's important to be part of networks like this to remind you that there's still many good and important people still committed to global health and doing the work. I'm originally from Uganda, I will put that caveat. And when I first came to Canada, the first thing my collaborators encouraged me to do was to join the Canadian Association for Global Health. That is the first thing I did, and I've been part of this network for years ever since, and I've built exceptional connections. The value as well is that we have many individuals who are perhaps entering global health or who are looking to collaborate in global health. And there is no better place than CAGH to provide those networks for you, whether it's One Health, humanitarian work, non-communicable diseases, women's health. The great thing about CAGH is one, it's diverse in terms of the sorts of individuals you can find, but also it brings several sectors together. So whether it's government, community organizations, advocates, just individual advocates as well as institutions, it brings that whole community together. So for me, it has been a value add in terms of the partnerships that we have to serve through the Africa Institute, that we can encourage them and bring them towards the Canadian Association for Global Health. And likewise, the association has an opportunity to leverage from our partners in Africa, right? So that exchange and collaboration is really what helps us move this work forward. And, with that, I also want to acknowledge the ongoing outbreak of Ebola that is happening in East Africa and our partners there. We thank you so much for the incredible work that you are doing to keep everyone safe and hantavirus. And basically, we have champions, and you are champions, and it's important to be part of this network because we continue to inspire one another. So that is the value of this network, and we thank you, CAGH, for always partnering with us at the Africa Institute.
Thank you. Thank you so much, Margaret. Those were really inspiring words. And these themes keep coming up. This idea of, global health is local health, working together, partnership, community, and then really the diversity of CAGH, not just in terms of the members and the organizations, but in the kinds of work that people are doing. This is one of the networks that really touches on every single health topic, and even beyond. And so it's really, really exciting to see and really great to hear your perspectives from an institutional point of view. Thank you to Jean-Pierre, Gabrielle, and Margaret. I'm trying to keep an eye on the time, and I want to give enough time to Muriel to talk a little bit more about the conference. But thank you again for sharing your experience with CAGH. I invite participants to pop in any questions that you might have, or you can follow up with us separately, and we can connect you. But thank you all again for your perspectives. So I would now like to turn over the mic to Dr. Muriel Maxeng from University of Montreal. We have a lot of questions about the conference already, Muriel, but we are really delighted to have you as one of the co-chairs of the conference with us here today. As Saad mentioned, this is one of the longest standing Canadian conference on global health, over 30 years. So certainly something to be very proud of. And we are just delighted to have you with us to share with us a little bit more about the conference and how we can get involved. So Muriel, over to you.
Thank you. Thank you so much, Nandita. Bonjour tout le monde. Hi, everyone. Namaste. Bariyako. Hola. Todas y todos. So those are some of the greetings that I've seen from countries that were popping up in the chat. So thank you so much for giving me the opportunity to briefly talk about the 32nd Canadian Conference on Global Health. And from now on, I'll refer to it as CCGH. I've been a longtime friend and ally of CAGH and the CCGH for the past 10 years. So since more than about 100 more participants have further joined online, I would like to reiterate some key information regarding the conference. So this year, the Canadian Conference on Global Health will take place, like Saad has mentioned, in Montreal from October 16th to 18th. So from Friday to Sunday. It's a bilingual English and French event, both in person and online, typically attracting around 350 in-person participants and over 400 online attendees, with about 60% joining from outside Canada. So I'll just quickly repeat what is this year's theme. It's really focusing on collectively reclaiming global health equity, restoring commitment to action in a fragmented and uncertain world. So each day will focus on a specific theme. Day one will explore the upstream determinants of global health equity. The second day will focus on equity in actions, so related to health systems, resilience communities, and marginalized voices. Day three will address all the knowledge translation and mobilization pieces from evidence to impact. So this conference goal is really to reclaim equity together through concrete action grounded in the belief that health is a human right and justice must guide every decision that we are taking. So in a world of shrinking resources and limited policy spaces, we aim to challenge the status quo and ensure no one is left behind. As Saad said, CCGH is the flagship event of the Canadian Association for Global Health and is Canada's largest and longest running conference dedicated to global health. The conference serves as a platform to advance dialogue, networking, partnerships, and evidence-informed action on pressing global health challenges, as mentioned by Margaret a bit earlier, among researchers, students, policymakers, practitioners, and partners from across Canada and around the world. So for the call for abstracts, which ended in April, we received a record 1,208 abstracts for oral presentations, posters, workshops, and symposia. And we are finalizing these days the evaluation of the abstracts with over 110 volunteer reviewers from academia, practice, and senior postgraduate students, both from Canada and LMICs. So we are really honored to have stellar plenary speakers, including Sarah Hawkes, leader of the Global 50/50 Report on Gender Justice and now head of Global Health at Monash University in Malaysia. Catherine Kyobutungi, the Executive Director of the African Population and Health Research Center in Kenya, and Carly Silver, who is the CEO of Grand Challenges Canada. So we'd love to have you join us in October. So registration is open with early bird rates available until July 31st. So please register. There are discounted rates that are available for colleagues from LMICs, students, retirees, and members of the Canadian Association for Global Health. So please register also to be a member. Although limited, there will be scholarship opportunities for students and LMIC participants. So please visit our websites for all the details. It's available both in English and French. And I'll share again the website link with all of you in the chat. And thanks for your attention.
Super. Thank you so much, Muriel, and congratulations on such an incredible event. Over 1,000 abstracts is quite impressive. And thank you to all the volunteers who are helping to screen and review them as well. There were some questions about the conference, which I think you addressed, but just to remind people that registration is open. There are discounted rates for people coming from LMICs or students or CAGH members. And there are a few scholarship opportunities available. Muriel, could you say a little word on that? I think there were a few questions on the scholarship opportunities.
Yeah, so we have limited, like I said, limited scholarship opportunities, but it's very important when you register that you tick the box that you would like to be considered for a scholarship. And it's a competitive process, but we'll be very mindful of who is applying, if they're students coming from LMICs, and having a regional distribution of awardees. So please just contact us, register, and tick the box that you'd like to be supported, and we'll try our best. We cannot provide scholarship to everyone, but we'll do our best.
Super. Thank you so much, Muriel, and thank you to the entire committee for putting this together. It's certainly a lot of work, but I think many of us are looking forward to the event in October. So we are coming towards the end of our session. Thank you to everybody who's stayed online. There's still over 200 folks online to learn more about CAGH. Again, materials are available on the website, including this recording that we will post there. And you can reach out to either any of us or through the website if you would like more information. We just have a few minutes left. I wanted to see if our chair, Dr. Saad, if you had any reflections, and then I'll turn it over to Shaheen for just a closing remarks.
Thank you very much, Nandita. And thanks to all the panelists and the participants for attending. This is it's really great, and hopefully we were able to give you a better picture of what the Canadian Association for Global Health stands for, and sort of insights into the Canadian conference, and inviting you there. We look forward to seeing you and to engaging more with you. Thank you. Back to you, Nandita.
Super. Thanks, Saad. I know there are a few questions online. We're kind of out of time, so I'm going to turn it over to Shaheen for just some closing remarks and next steps. But please do stay in touch with us and visit the site. You can find information there, and we're happy to sort of connect offline. So Shaheen, over to you, my co-chair for this event.
Oh, no, this has been so great,
remarks.
Nandita. Thank you, first of all, Nandita, just for being part of this. And thank you all so much to all of the speakers today for taking time out of their schedules as well to be here, and just for giving just the diverse perspectives. I think it's just such an important time in global health, and there's so much that we can do from a local perspective to work at the global perspective, right? And we see so much going on, as we've already heard, but we do have a role to play, no matter what discipline we're from, no matter what role we're sitting in right now, whether it's a student or a CSO leader, or a non-leader, an individual who's, wanting to participate. CAGH has a real unique space for us to be part of. And so we welcome you to learn more about us and to join us in our efforts and the leadership that Canada is taking to be part of the global health discussions and advance equity. So thank you all so much. Think about what your next steps are, including going to the websites that we've provided in the chat to be part of the conference, to become a member. There's so much so much work for us to do together collectively. So thank you just so much for your time, and if you know anyone who wasn't able to participate today or come, just to reiterate what Nandita said, that we have recorded today's session, and you'll find it on the website. So spread the news and spread that webinar messages out. And thank you all so much from around the world. I think that's all I had to say. And take care, stay safe, and we hope to see you all again soon.
Thank you so much. Thanks, everyone.
Great. Thank you.
Thank you.